Okay, picture this. You walk out to the pasture, quiet morning, everything seems fine, and then you see it. Your horse, head low, and the muzzle is just swelling up fast. They're clearly distressed. That feeling, right? That immediate, like, jolt of panic.
Mm-hmm.
Because you just know this could be a snake bite.
Mm-hmm.
And well, it's a massive emergency in the horse world.
It absolutely is. And, that moment when you first realize what might be happening, that's actually a critical first step.
Yeah.
Because like we're going to get into in this deep dive, moving quickly, knowing what to do, it really can be the difference between life and death for the horse.
Exactly. So today, that's our focus. We're doing a deep dive into snake envenomation in horses. And it's not just serious, it's really complex, something every horse person kind of needs to understand, really.
Definitely. It touches on so many areas.
Our mission here is to try and unpack it all. We want to get into how the venom works, maybe touch on some, surprising things you might not expect, really stress why acting fast is so critical, and maybe even look a bit at what's next for treatment.
Yeah, we've pulled together a good stack of research articles, expert notes here to guide us through it.
All right, let's jump in. So, first off, horses are huge, right? It seems like maybe they could just shrug off a snake bite. But the sources are really clear. You absolutely can't underestimate the danger.
That's a really crucial point. Size helps, but it's not everything. Yes,
Okay.
especially like you said, bites to those vital areas, the muzzle, the head, the neck. That swelling can happen incredibly fast and, well, it can lead to life-threatening respiratory compromise quickly.
And it's not always the same outcome, is it? It depends on a lot of things.
Exactly. It's not predictable. The sources call it a multifaceted interaction. Think of it like a combination of factors. The specific snake involved, the horse itself, its health, its size, and just the circumstances of the bite. So much variability.
Okay, let's dig into the venom itself. We think poison, but it's way more complicated than that, isn't it?
Oh, absolutely. Snake venoms are incredibly sophisticated cocktails. We're talking hundreds of different enzymes, proteins, peptides, all mixed together. And here's the key thing. The exact recipe varies hugely, not just between, say, rattlesnakes and coral snakes, but even sometimes within the same species from different regions.
Wow. So that complexity explains why they do so many different things to the body.
Precisely. And importantly, these effects often overlap. It's rarely just one neat category.
Okay, so what are the main ways venom works? Let's break that down.
All right, first there's cytotoxicity. That basically means tissue damage. Think pit vipers here. Crotalids. Their venom is notorious for causing really severe local injury, intense pain, massive swelling, edema, blistering, and even dermatocrosis, which is, well, skin death.
Ouch. Sounds destructive. How does it do that?
It uses enzymes like hyaluronidase and collagenase. These literally break down the glue holding tissues together. And metalloproteinases attack blood vessel walls. It's like a biological wrecking ball causing profound local destruction. Sometimes tissue just slides right off.
Okay, so that's the visible damage, but it messes with the blood too, right?
Yes, that's hemotoxicity. It targets the blood and the clotting system. Again, crotalids are big players here. They can cause something called consumption coagulopathy. Imagine the horse just burns through all its clotting factors really fast.
So they can't stop bleeding.
Exactly. It leaves them prone to spontaneous bleeding. You can also get issues like tiny clots forming in small vessels, low platelet counts, even acute kidney injury from all this chaos.
And then there's the nervous system angle.
Right, neurotoxicity. This is the hallmark of elapid venoms. Think cobras, coral snakes, mambas. Their venom primarily attacks the nervous system. It causes this descending, floppy paralysis. And the most critical part, it can shut down the breathing center in the brain.
Scary. And you said some rattlesnakes can do that too.
Yeah, that's where it gets tricky. Well, it's classic for elapids. Some crotalids, like the Mojave rattlesnake, have neurotoxic components too. Adds another layer of complexity for vets.
So it sounds like these effects are almost never just one thing. Cytotoxicity could affect kidneys. Neurotoxicity could cause oxygen deprivation. It's all connected.
That's a really critical takeaway for you. Venom effects are rarely isolated. Severe local swelling, for instance, can lead to shock, which then impacts the heart and kidneys, or that neurotoxic paralysis causes hypoxia, lack of oxygen, which then damages the brain, heart, other organs secondarily.
So treatment has to be broad, then. You can't just focus on one symptom.
Exactly. It demands a holistic approach. You have to anticipate and manage potential problems across multiple organ systems all at once.
Okay, to make this super clear, let's do a quick compare and contrast. Elapid versus crotalid bites in horses. Understanding the differences seems vital.
Good idea. Let's start with fangs, elapids. Short, fixed fangs. like little permanent needles.
And crotalids.
Long, hollow fangs that are hinged. They fold back against the roof of the mouth when closed. Much bigger delivery system.
How they bite is different, too.
Yeah. Elapids often tend to sort of chew or hand on, injecting venom more gradually.
Whereas crotalids...
Usually a very fast strike, and then they withdraw immediately. Think rattlesnake strike.
Okay. And primary toxicity.
Elapids, predominantly neurotoxic. Nervous system effects are key. Crotalids, typically hemotoxic, messing with blood clotting, and cytotoxic, causing that severe tissue damage.
Which leads to different signs you'd see.
Definitely. With elapids, you might see surprisingly minimal local pain or swelling at first. The big signs are systemic. Neuromuscular weakness, staggering, that progressing paralysis, and ultimately respiratory failure.
And crotalids.
Much more dramatic locally. Severe pain, rapid swelling, the tissue might look discolored, maybe oozing bloody fluid. Plus those internal signs like clotting problems, spontaneous bleeding, often shock.
But always remember that exception, right? Some crotalids can have neurotoxic effects too.
Crucial point, like the Mojave. Never assume.
And generally, what's the prognosis difference?
For elapids, if the horse survives that initial paralysis phase, especially with antivenom, recovery can be complete. Survival rates are pretty good, around 86% with treatment. For crotalids, the horse's sheer size often prevents immediate death from the venom itself. But, and this is a huge but, bites to the muzzle, head, or neck are incredibly critical.
Because of the swelling and breathing?
Exactly. That severe swelling can cause asphyxiation. That's the immediate life threat there.
Okay, that clarifies the venom side. But what else influences how bad a bite actually turns out to be? It sounds like more than just the snake is involved.
You got it. It's definitely a complex interplay. We can break it down into factors related to the snake, factors related to the horse, and then circumstantial factors.
Makes sense. Let's start with the snake itself. Species matters, right?
Absolutely. The sources point out, for example, that diamondback rattlesnakes generally cause the most severe envenomations.
And on the other end?
Copperheads are usually considered the least severe, often more localized swelling, less systemic trauma.
Does the snake's size matter? Like a bigger snake means more venom.
Generally, yes. Larger, older snakes tend to have larger venom glands and can inject a larger dose.
What if the snake just ate a mouse or something? Does that make a difference?
It potentially can. A snake that recently used its venom for hunting might have partially depleted glands. This could lead to a less severe bite, or even what's called a dry bite, where it strikes but injects no venom at all.
Ah, the dry bite. We'll come back to that. What about multiple bites?
Obviously worse. More bites equals a higher total venom load. Simple maths there.
Okay, now let's flip it. What about the horse? How do its characteristics play a role?
Size and age are pretty significant. Larger horses generally handle a given dose of venom better just due to dilution in their larger body mass. Foals, conversely, are much more vulnerable. Smaller size, less developed systems.
Any pre-existing health problems?
Yeah, those can definitely complicate things. Concurrent conditions or even certain medications the horse might be on can potentially worsen the outcome.
But you mentioned location earlier as being super critical for the horse.
Yes. Bite location is arguably one of the most critical horse factors.
But remind us why. Muzzle, head, neck.
Because of that rapid, severe swelling. Horses have to breathe through their noses. They're obligate nasal breathers. If that muzzle swells shut, their airway is gone. It leads directly to respiratory distress and potentially suffocation. Very quickly.
Whereas a bite on the leg.
Still very serious, causes significant local damage, pain, lameness, but usually doesn't carry that same immediate threat of asphyxiation.
Okay, in the last category, circumstantial factors.
Right. This includes things like the actual amount of venom injected. Was it a full dose, a partial dose, or maybe none at all, that dry bite again?
And how fast you act.
Absolutely crucial. The time between the bite happening and the horse getting veterinary attention, plus the quality of any first aid given, that massively impacts prognosis. Because remember, the venom starts causing irreversible damage almost immediately. Time is tissue.
This brings us back to the dry bite dilemma. It sounds counterintuitive. How common is that, and how can you tell?
It's a real phenomenon, though exact percentages are hard to pin down. A snake might strike defensively without injecting venom.
But you'd still see fang marks, right?
Usually, yes.
Yeah.
And that's the key challenge. Fang marks alone do not confirm that venom was injected. You could see two perfect little holes and have zero venom on board. And there's really no reliable way for an owner or even initially a vet in the field to know for sure just by looking.
So what's the practical takeaway here for you, the listener? If you see fang marks or even just suspect a bite,
Treat every single suspected bite as an emergency until proven otherwise by a vet. Assume envenomation has occurred.
better safe than sorry.
Absolutely.
Yeah.
This ensures horses that are critically envenomated get the urgent care they need without potentially giving unnecessary and not entirely risk-free anti-venom to a horse that only got a dry bite.
Okay, so you suspect a bite. Maybe you saw the snake. Maybe you just find your horse acting strangely. What specific signs are you looking for?
Well, the onset can be fast within minutes, or sometimes delayed for several hours. It depends. Initially, you might just see sudden weakness. Maybe the horse collapses briefly, or seems lethargic or oddly excitable.
And you mentioned something tricky earlier, a misleading recovery.
Yes, that's critical. Sometimes a horse might seem to perk up shortly after the bite. Don't be fooled. Those toxins are still circulating and spreading internally. Things can deteriorate again rapidly, even after they seem better for a bit.
Okay, huge red flag there. What about the local signs, especially with those crotallid bites that cause so much tissue damage?
With crotalids, you almost always see very rapid, very dramatic pain and swelling right at the bite site. It's usually unmistakable. The tissue might start to discolor quickly, turning dark purple or black. You might see bloody fluid oozing from the fang marks.
And you always see the fang marks?
Not always. There might be one, two, or sometimes more punctures, but they can be tiny, hard to find in the hair, or quickly hidden by the swelling. Later on, maybe hours or days, you might see blistering, skin starting to separate, or even outright necrosis where the tissue dies.
What about signs linked to specific body systems, breathing problems, for instance?
Respiratory distress is the big one for head and neck bites. You'll hear labored, noisy breathing. It sounds like they're struggling to get air in. And again, because they can't switch to mouth breathing, this can become an airway emergency very fast.
Neurological signs, especially with elapids.
Right. You're looking for generalized muscle weakness, staggering, maybe muscle twitches or tremors, fasciculations. It can progress to the horse going down and being unable to get up recumbency. Dilated pupils, droopy eyelids, maybe the tongue seems weak. Ultimately, it leads to respiratory failure due to paralysis.
And those leading issues you mentioned earlier, the hemotoxicity, how would an owner spot that?
That's coagulopathy or hemorrhage. Look for unexplained bleeding, maybe from the nose epistaxis or blood in the urine hematuria. Sometimes you might see little pinpoint bruises on the gums, or just notice that a small nick isn't clotting properly.
Any other general signs?
Yeah, you might see signs of colic, signs of shock like pale gums and a rapid weak pulse, maybe a wobbly gait, or even signs of muscle damage like dark urine.
Okay, you've seen the signs, you suspect a bite. What are the absolute must-do first aid steps before the vet gets there? And crucially, what should you definitely not do?
This is so important. First rule, snakebite is a true emergency. Call your vet immediately. That's step one. Your main job as the owner, then, is to keep the horse as calm and still as possible.
Limit movement. Why is that so important?
It helps slow down the absorption of venom into the bloodstream and lymphatics. Less activity, slower spread.
What about airway? If it's a muzzle bite and they're struggling to breathe?
Maintaining an open airway is paramount. If breathing is clearly restricted, your vet might actually instruct you over the phone on how to carefully insert something like short sections of clean garden hose into the nostrils. Lubricate them well with Vaseline, maybe tape them lightly. It's a temporary measure until they arrive.
But that's only if the vet advises it, right?
Absolutely. And severe cases might need a surgical airway, a tracheostomy, which is strictly a veterinary procedure.
What about putting ice on it? Does that help?
Yes, cold therapy can be beneficial. Applying ice packs or running cold water directly over the bite site helps reduce swelling and pain by constricting local blood vessels. For a limb bite, you can stand the horse in a bucket of ice water or use what's called a stack wrap with continuous cold water hosing if possible and safe to do so.
Okay, now for the big don'ts. What are those common mistakes people make? Maybe things they saw in a movie that are actually harmful.
This is vital. Please do not try to cut the wound open to let the venom out. It doesn't work. It causes more tissue damage, increases infection risk, and stresses the horse.
Don't try to suck out the venom.
Absolutely not. Also ineffective for the horse and incredibly dangerous for the person doing it. You could absorb venom through your mouth.
Tunicates, tight ones.
Avoid applying a tight tourniquet above the bite. While a loose constrictive band might sometimes be advised by a vet specifically for certain neurotoxic bites to slow lymphatic spread, a tight tourniquet cuts off blood flow and can cause catastrophic tissue damage, potentially leading to limb loss. It often does more harm than good, especially with cytotoxic venoms.
Any other things to avoid?
Don't apply weird chemicals, poultices, or try any kind of field surgery. Just keep it simple, keep the horse calm, get the vet on the way.
So, bottom line, the most important first aid step is?
Call your veterinarian immediately.
Mm-hmm.
Early intervention is the single biggest factor in improving the outcome. Time is absolutely critical.
All right, the vet arrives. What's the main tool in their arsenal? It has to be antivenom, right?
Correct. Antivenom, or antivenin, is the only specific antidote we have. It directly neutralizes the snake venom. It's made of purified antibodies, usually from horses or sheep that have been immunized with small doses of venom. These antibodies bind to the venom toxins and stop them from causing further damage.
Are there different kinds? Like for different snakes?
Yes, there's monovalent antivenom, which targets the venom of one specific snake species, and there's polyvalent, which contains antibodies against several different species common to a particular region.
Which one do vets usually use?
Polyvalent is often preferred, especially if you didn't actually see the snake or aren't sure of the species. It covers more bases.
Is it used for every single bite automatically?
Well, not necessarily. It's most clearly indicated for severe cases. So if the horse is showing systemic signs, bleeding problems, neurological issues, shock, kidney injury, or if there's really rapid, extensive local swelling, especially if it's threatening the airway or a limb, the vet weighs the potential benefits against the potential risks of an adverse reaction to the antivenom itself.
Timing must be crucial, right? You mentioned damage starts immediately.
Absolutely critical. Antivenom is most effective when given as early as possible, ideally within the first 6 hours after the bite. It can still help later, but the sooner it's on board, the more irreversible damage it can prevent.
How is it given? Just an injection?
It's usually given intravenously, IV. Often it's diluted in fluids and given as a slow infusion over maybe an hour, or sometimes as a very slow IV push. Giving it directly into the swollen tissue around the bite isn't generally recommended. It's painful and probably not very effective. You want it in the bloodstream to neutralize circulating venom.
Okay, here's a really interesting point you touched on earlier. How is it dosed? Is it based on how big the horse is?
That's a great question, and it surprises a lot of people. No, antivenom dosing is based on the amount of venom thought to have been injected, not the horse's weight. The idea is you need enough antibody molecules to neutralize the venom molecules, regardless of the patient's size.
So even one vial can make a difference in a big horse.
It can help, yes, but severe envenomations often require multiple vials. Especially with elapid bites, the venom can be potent and require larger amounts of antivenom. We saw that study mentioning 43% of elapid cases needed more than one vial. And doses can be repeated if the horse isn't responding adequately or signs worsen.
Now, since it often comes from other horses, there must be a risk of reactions, right? What should owners know about that?
Yes, that's a definite possibility, and something vets are always prepared for. There are two main types of reactions. Early reactions are typically anaphylactic or anaphylactoid. They happen within minutes to hours of getting the antivenom.
What does that look like?
It can range from mild signs like itching, hives, maybe a cough or fever, some GI upset, rapid heart rate, to severe life-threatening reactions involving a sudden drop in blood pressure, shock, and bronchospasm, making it hard to breathe.
How do vets manage that?
Epinephrine adrenaline must always be ready to go for immediate injection if a severe reaction occurs. Antihistamines and corticosteroids might also be used beforehand or for milder reaction.
And you said there are later reactions, too.
Yes, late reactions, known as serum sickness. These can pop up days or even weeks later. Symptoms are usually things like fever, maybe nausea, itching, joint pain, muscle aches. These generally respond well to treatment with antihistamines or steroids.
So close monitoring after giving antivenom is key.
Absolutely. At least for a couple of hours, very closely for any immediate issues.
Okay, so antivenom is crucial for stopping the venom, but what about all the damage that's already happened? Or the ongoing effects? That needs managing too, right?
Exactly. Antivenom stops the progression, but it doesn't reverse damage already done. Comprehensive supportive care is just as vital. Hospitalization, often for 24 hours or more, is usually necessary.
What does that supportive care involve? Fluids.
Fluid therapy is huge. Fully fluids are critical to combat shock, whether it's from fluid leaking into swollen tissues, the venom dilating blood vessels, or even from an antivenom reaction. Sometimes pressor drugs are needed too to keep blood pressure up.
And pain. These bites sound incredibly painful.
They are. Pain management is essential for welfare. NSAIDs like bute or banamine are commonly used. But you have to be cautious if there's coagulopathy, as NSAIDs can worsen bleeding tendencies. Opioids might be used for very severe pain.
What about helping specific organs that are struggling?
Yes, organ system support is key. For respiratory issues, besides nasal tubes, a temporary tracheostomy might be needed. Severe neurotoxic paralysis might even require mechanical ventilation. For the kidneys, if acute kidney injury develops, aggressive IV fluids are the main treatment. Cardiovascular support means monitoring heart rate, rhythm, blood pressure, and treating any arrhythmias that pop up. And if coagulation is severely messed up, transfusions of fresh frozen plasma or whole blood can be life-saving. And definitely avoid sticking needles into muscles if the horse isn't clotting properly.
What about infection risk? Snake bounds aren't exactly sterile.
Good point. Broad-spectrum antibiotics are standard practice because the bite introduces bacteria from the snake's mouth and the environment. And a tetanus booster or antitoxin is always recommended too. Tetanus spores can easily get into puncture wounds.
Any role for corticosteroids?
It's a bit controversial for the local swelling. Some think it might hinder healing or worsen necrosis, but they might be used in cases of severe shock or allergic reactions.
And making sure they can eat and drink if their face is swollen.
Right, nutritional support. If facial swelling is bad, they might need help eating or drinking. Importantly, avoid feeding them off the ground, as lowering the head can make facial edema worse. Elevated feeders are better.
Okay, beyond the systemic stuff, what about managing the actual bite wound? That local tissue destruction sounds nasty.
Wound management is a big part of the long-term care. You have to constantly monitor the site for increasing swelling, blistering, or signs of tissue death, necrosis. Surgical debridement, which is removing the dead or dying tissue, is often necessary. Venom can hang around in tissues and keep causing damage.
Does that leave scars?
Unfortunately, yes. Debridement can sometimes lead to significant cosmetic defects, especially if large areas are involved.
And keeping it clean.
Yes, infection prevention is key, with antibiotics, as we mentioned, and good local wound care. Topical ointments like triple antibiotic or silver sulfadiazine might be used initially, but some topicals can slow down healing later, so they're usually stopped once healthy granulation tissue starts forming.
You mentioned compartment syndrome earlier. Is that a wound complication?
It can be, though it's rarer in horses than people. If limb swelling is incredibly severe and rapid, it can cut off blood supply to the muscles within that fascial compartment. If confirmed, and clotting is okay, a vet might perform a fasciotomy, surgically cutting the fascia to relieve pressure. But honestly, the best way to prevent it is early, adequate antivenom.
So wound care can be a long haul.
It definitely can. Tissue destruction might continue for weeks. You can end up with large, complicated, infected wounds that take a long time to heal, especially in the lower legs. Bites near joints can cause lasting lameness.
Wow. So after all this intensive care, what influences whether a horse makes a full recovery? What determines the overall prognosis?
It really comes back to those key factors we discussed earlier. The snake species and how much venom was likely injected. Critically, the bite location again, muzzle, head, neck bites, generally carry a more guarded prognosis because of that airway risk.
And how quickly treatment started.
Hugely important. Getting that vet care, and especially antivenom, within those first 6 hours makes a massive difference. The horse's own health status and size play a role too. And of course, whether significant complications develop, like kidney failure or severe tissue necrosis, and how well the horse responded to all the treatments.
You mentioned a 24-hour rule for pit vipers earlier.
Yeah, the general guideline is that if a horse bitten by a pit viper is still active and alert 24 hours after the bite, it's unlikely to die from the direct effects of the venom itself at that point. The initial crisis period is usually within that first day.
And a lapid survival is pretty good with treatment.
Yes, that 86% figure with antivenom is encouraging for elapid bites, provided respiratory support can be maintained through the paralysis phase.
That covers the immediate survival. But what about down the road? Are there long-term problems owners need to watch for even months later?
This is a really important area and why follow-up care matters. Even after a horse seems fully recovered, serious issues can emerge weeks or months later. One major concern is cardiac dysfunction. Chronic heart problems, even heart failure, can develop quite some time after the bite. It seems potentially more common in horses post-snake bite than in some other species.
What would owners see?
Signs like unusual shortness of breath, taking longer to recover after exercise, maybe a cough, or the vet might hear abnormal heart sounds. Regular cardiac checkups after a significant bite are probably a good idea.
What about the kidneys?
Renal damage. If the horse had acute kidney injury during the bite, it could potentially progress to chronic kidney disease over time, affecting long-term health and performance.
And neurological problems.
Yes, potential neurological effects. While the acute paralysis from neurotoxins often resolves, there can be lingering weakness. Or, if the brain didn't get enough oxygen during respiratory compromise, you could see permanent damage like ataxia, poor coordination, or even partial paralysis. Blindness has also been reported.
And the bite site itself, especially on a leg.
Musculoskeletal disabilities are definitely a risk with severe local tissue damage. Extensive necrosis of skin and muscle can lead to major tissue loss, scarring, fibrosis, and contractures that limit joint movement and cause chronic lameness.
Could it be bad enough to need amputation?
It's rare, but partial amputation or euthanasia due to untreatable limb issues isn't unheard of in catastrophic cases.
Hmm.
More commonly, you might see chronic non-healing ulcers or persistent pain and swelling at the site that lasts for months or years.
Does the whole traumatic experience affect the horse mentally?
It's harder to quantify in horses than people, where PTSD after severe illness or injury is well recognized. But it's certainly plausible that the prolonged pain, intensive treatment, isolation, and physical limitations could lead to lasting behavioral changes related to stress, anxiety, or discomfort in some horses. It's something owners should be mindful of.
This really underscores how serious these bites are, which brings us to prevention. What are the best ways to stop this from happening in the first place?
Absolutely. Prevention is key, and it involves managing the environment around your horses.
Starting with knowing what snakes live in your area.
Exactly.
Huh.
Everyone working on the farm should be able to identify the local venomous snakes. Know what rattlesnakes look like, the rattle, the triangular head, the facial pits. Know your copperheads, cottonmouths, or coral snakes if they're in your region.
And then making the place less inviting for them.
Right. Habitat modification. Clean up potential hiding spots, junk piles, old lumber, tall grass right near barns. Even poorly stacked hay can be attractive.
What about their food source?
Rodent control is huge. Mice and rats are a major food source for many snakes. Fewer rodents means fewer snakes hanging around barns and feed rooms.
Anything else for pastures?
In hot weather, when snakes are most active, maybe rotate grazing areas, avoiding known snake habitats like rocky outcrops or dense brush if possible. And if you see a venomous snake, don't try to handle it yourself. Report it for professional removal.
Okay, what about the rattlesnake vaccine? How effective is that?
The rattlesnake vaccine works by stimulating the horse's own immune system to create antibodies against rattlesnake venom. The idea is that if the horse is bitten, these pre-existing antibodies help neutralize the venom faster, reducing the severity of the symptoms. It can potentially lessen the clinical signs and maybe even reduce treatment costs.
How is it given?
It's usually an initial series of injections, often 3, spaced a few weeks apart. Then boosters are typically recommended every 6 months or so, especially before peak snake season, to maintain immunity.
So if my horse is vaccinated, I don't need to worry if it gets bitten. No need to call the vet.
No, absolutely not. That's a critical misconception. While the vaccine aims to reduce severity, its effectiveness can vary depending on the snake species involved. It's primarily targeted at western diamondback venom, though offers some cross protection, the amount of venom injected, and the individual horse. Even if vaccinated, you must still consider any suspected rattlesnake bite an emergency and call your veterinarian immediately. The vaccine is an aid, not a substitute for prompt veterinary care. Think of it like a flu shot. It helps, but doesn't guarantee you won't get sick.
This has been incredibly informative, covering so much ground. Before we wrap up, what's emerging from research? Are there new developments on the horizon for diagnosing or treating snake bites in horses?
There are some really interesting areas being explored. One potentially huge development is looking at oral immunization for antivenom production.
Oral immunization. Instead of injecting the horses that make antivenom, how would that work?
Exactly. The traditional way of making antivenom involves repeatedly injecting horses with venom, which, as we discussed, is expensive and can cause significant health problems for those production horses: pain, abscesses, severe reactions.
Right. It contributes to cost and shortages.
Well, some early research is showing promise for giving horses sublethal doses of venom orally, mixed with special substances called adjuvants that boost the immune response. In these initial studies, the horses developed high levels of neutralizing antibodies, the very thing needed for antivenom, but without the significant side effects seen with injection.
Wow. That could be revolutionary.
It really could. If this pans out, it might make antivenom production much cheaper, safer for the animals involved, and potentially increase the global supply, which is a huge issue, especially in developing countries.
That's fascinating. What about diagnostics, those rapid test kits?
That's another area where research highlights a challenge. We mentioned snake venom detection kits, SVDKs. A study looking at elapid bites in Australian horses found these kits, using urine samples, only correctly identified envenomation in about 17% of confirmed cases.
So a negative test doesn't mean the horse wasn't bitten?
Precisely. It means you can't rely on a negative result from these current kits to rule out a bite, especially with the lapids. It shows we still need better, more reliable, rapid diagnostic tools for field use in horses.
Is research also just giving us a better picture of certain types of bites, like those elapids?
Yes, studies are continually refining our understanding. For example, confirming that elapid bites often present with that primary neuromuscular weakness, frequently without an obvious bite wound being found, and consistently documenting associated problems like muscle breakdown, rhabdomyolysis, and red blood cell destruction, hemolysis. This detailed knowledge helps vets recognize these less common but highly dangerous bites more quickly.
We have covered so much ground today. It's clear that snake envenomation in horses is a really critical and honestly quite complex emergency. We've unpacked the intricate ways venom works, the factors that influence severity, the absolute vital steps for first aid, the vet's arsenal including antivenom, and even those potential long-term consequences.
And we've also touched on prevention, from managing the horse's environment to the role of vaccination. I think the recurring theme through all of this is just how essential swift, informed action and a really comprehensive, holistic treatment approach are. That's what truly safeguards the horse's health.
So as we finish this deep dive, here's something to think about. We've talked a lot about the science, the molecular mechanisms of venom, the immune response. Consider how studying these incredibly intricate biological battles, these interactions happening right in nature, doesn't just help us treat snake bites better. It pushes our whole understanding of medicine and biology forward. What other unexpected insights, what other connections might we uncover just by looking closely at the complex natural dramas playing out around us?